Good morning. It's a joy to be here and share with you a model we have been using here in Sri Lanka, where we brought in interfaith leaders to support the Ministry of Health. I represent Alliance Development Trust, an NGO, and we play a role of a connector where we brought in these two key stakeholders to address a national issue. So let me start. I first wish to acknowledge our partners, the Anti-Leprosy Campaign and the Health Promotion Bureau from the Ministry of Health in Sri Lanka, our funders, the Leprosy Mission England and Wales, and our faith partner, the Interreligious Peace Foundation. I will be citing examples from our work in leprosy and how when COVID hit, we were able to use the same structure to respond. And I will take you through this model and the steps we followed and hope you will get an insight into some of the principles for engaging interfaith groups so that we could apply it to child sexual abuse prevention. Before I get into the meat of it, let me tell you briefly what we achieved through this. We found faith leaders fighting misinformation, supporting contact screening, reducing stigma in the community, and mobilizing communities towards action. But how did it all begin? It started by us forming key partnerships. We believe in working through existing structures. So our first step was to meet with the government as they had a plan to defeat leprosy. We did not want to run in isolation. Pictured here on my left is that meeting with the former health minister and our funder. And once we put a plan, we signed an MOU with the government. Then it was about looking for faith leaders who would be willing to come on board. Here, we found an interfaith group that had been established for peace building, but they didn't really have groups in every district. So we asked them if they would form a network in every district, that we would give them a tool for peace building. And we introduced them to the government to support a leprosy campaign, and they bought it. Our idea was that we would take credible information from the government and share it through trustworthy individuals such as these faith leaders. We felt that was a winning formula. The first step was together that we would organize an international interfaith conference. As you see, seated here at the head table, we had the senior religious leaders sitting alongside the Ministry of Health and our organization. And in the participants, we had interfaith leaders representing all 25 districts of our country. And we sat all of them at 25 tables representing the 25 districts. And at each table, there sat the government representative for leprosy control, which is the public health inspector. So at the start of the program, the Ministry of Health shared about leprosy and sold the cause to these faith leaders. Thereafter, each faith leader from representing the different faiths got up and endorsed the campaign. And then next, while these participants sat at the district tables with their public health inspector, they planned activities together in how they could take this, what they heard, forward. And as you can see here, this was a structure that we had for every district, where the public health inspector had with him a Muslim priest, a Buddhist priest, a Hindu priest, and a Christian or a Catholic priest, all to support him on his campaigns. So once they went back, we heard of stories, firstly, how they started taking the message back to their other faith leaders within their faith groups. And already we saw multiplication happening. Next, they took the message to their congregations. Pictured here is a program at a Hindu temple. And you can see The other faith leaders also joined in to support. Because this was at the Hindu temple, the Hindu priest stood up and was given the mic first, and he shared a message addressing stigma. Why the congregation needs to love people affected by leprosy. Then the mic was given to the public health inspector, and he shared the signs and symptoms and where they could get treatment. A simple combination brought people forward for treatment. But they did not end there. They took it beyond the four walls of their temples. They took it to the communities. For example, there would be priests who would say, we know a school principal in our area, and then together they would go and do programs in the schools, in the prisons, with other community leaders. Pictured on the right, it's a door-to-door campaign. Wherever the need was and the public health inspector guided them, they would go. We also found that contact tracing improved in districts that ran the Interfaith network compared to the districts that did not have active Interfaith networks. And when COVID hit, because we had the same structure in place, we were able to mobilize these faith leaders via WhatsApp. So once again, we shared the credible information received from the Minister of Health through using WhatsApp, through the faith leaders who shared it with their communities. We also found the faith leaders addressing the hunger during that time. And they were taking the dry ration packs, mobilizing the communities. Along with that, we shared these parenting tips developed by WHO, CDC, and UNICEF and the partners to address violence against children. And that message too went into the communities. So let me end here. First, before I talk about the factors of success, the model in brief. We met with key partners, the government and the faith leaders. We then ran an interfaith conference together, and they took the message to their other religious leaders within their faith groups, then to their congregations, and then into the communities. So the factors of success were that we worked with existing structures. We did not want to reinvent the wheel. And we were okay to be in the background. The conference, we ran it with the government logo, not our logo, not our funders logo, but that is because we had a partner who did not want their name put out or didn't see the need to put it out, as they wanted leprosy defeated more than their name promoted. And be agile. We found new opportunities along the way. This was not how we planned it, but when we found an opportunity, we seized it. And we kept the focus. We regularly met with these faith leaders to keep reminding them of the cause, because other priorities keep coming their way. And finally, we invested in relationships. We had one person just looking at forming relationships with the government, and another person just forming relationships with the faith groups to address all their issues and concerns, to iron things out, and just to build with them. So thank you. I hope this will help us to address this cause that is before us. Thank you.